This is the Optimal Wellness Podcast, helping you achieve optimal wellness naturally, with your host, Dr. Clifford Fetters of Health and Wellness of Carmel.
Welcome to the Optimal Wellness Podcast, inspiring you to lead a healthier lifestyle. I'm Dr. Clifford Fetters.
And I'm Jenna Toupin.
And we're here to discuss breast cancer.
So, as you already said, we're kind of talking about a topic that's a bit heavy. I read a stat the other day, so you can tell me if I'm correct in this, but 1 out of every 8 women in the U.S. are diagnosed with some form of breast cancer, which is pretty crazy to say.
Right, that's way too many.
Yeah. So tell us a little bit more about overall just prevention that you recommend for overall like women that come to see you.
Yeah. People don't understand that 90% of all breast cancer is due to the environment.
Yeah.
So before we even start about prevention, I want to talk to all women out there that 20% of every woman that notices a lump in their chest or in their breast will never see a doctor. 20%. And I see women stage 4 that started with the size of a pea and now it's the size of their fist, and they were so afraid of what would happen. And I treat all types of cancer, and breast cancer is by far the easiest cancer to treat, to diagnose. And in the state of Indiana, we're the best state in the nation to do holistic health care. No doctor can force you to do chemotherapy or radiation or biopsies or any treatment at all. Integrative doctors have the benefit of having a statute in our Constitution allows any doctor in good standing to provide holistic cancer care at any stage, regardless of FDA approval, and that's nowhere else. And I've worked with Attorney General, and our entire state knows that, and the oncologists know that. They know that 20% of all women diagnosed with breast cancer today will not see a doctor, but they will see me. And when they see me, and if it is stage 3 or 4, you should see the oncologist, because the oncologist has targeted therapies that is not chemotherapy, that does not have the side effects. And in the state of Indiana, they work with integrative doctors if needed. Stage 1, stage 2, early diagnosis usually does not need to see an oncologist at all, but it's worthwhile to see them and see what the options are. So just if you have a lump, you should talk to your primary care doctor. You rarely need a biopsy. There's other treatments we're going to talk about. So if you have a lump, talk to your doctor. And we're going to talk about prevention in a second, but if you have lumpy breasts, and I just had a 21-year-old with the worst mammogram possible, ultrasound lump, the most dense breast tissue, painful, and her screening cancer test was positive, but the more advanced, she had no circulating tumor cells, so she was okay, but these painful breasts is because her estrogen was sky high, which we're going to talk about. So we just actually, within 2 months of using our treatment to get rid of the estrogen, her breast exam is normal, her ultrasound is normal, and she had no circulating tumor cells. But that was a warning to her. It's like, okay, why do women get breast cancer? In this toxic world, their estrogen levels are sky high, they don't have enough progesterone, and all breast cancer, at least 95% should be prevented. And if you have it, the treatment is easy. It's my favorite cancer to treat because the prognosis is virtually 100%.
You touched briefly on the screening tests, talking about so I'm assuming you're talking about the OncoTrace and OncoDeclare.
Right.
Can you talk a little bit more about that to the audience?
Sure, right. So if you have a lump, usually we do an ultrasound. And most of the time when it's lumps, it's benign. Women get cysts all the time. But if you keep getting cysts, if you have painful breasts, that's not normal. If everything's okay now, but if you're constantly having painful breasts, there's a serious problem. You need to see a doctor and just get rid of the estrogen and what's causing the high estrogen. So if you want to do screening, as you know, OncoDeclare is just available in the last 12 months. So everyone in this room has cancer cells in their body. But the question is do they have cancer? So the OncoDeclare tells you, based upon your age, do you have more cancer cells than the average person your age? And if you're like me, who's OCD, and it's like, okay, I want to know if I'm worse than the average person, then I will do what it takes. Just like a heart scan. Men used to laugh at me, they smoked and drank, and they passed a treadmill. Well, a treadmill is almost worthless for whether you have heart disease or not. But if you have more cancer cells in your body than you should, then you should do something. But if you do flunk that test, then you need to do the OncoTrace. If you have circulating tumor cells in your body, that's never normal. And when we do an OncoTrace, it tests for the 8 most common cancers.
Okay.
And if you have the genetic marker for breast cancer, then it's you have breast cancer.
Okay.
So you don't need to do a biopsy.
Okay.
And then you can go to, I still want to do thermography, mammography, just to see how large it is. And for the women that, the treatments we do is often not covered by insurance. So you can just see the oncologist and make sure there's nothing else going on, and you can have a surgeon just remove it. And a small lump is taken care of. We don't do radical mastectomies at all anymore, and there's reconstructive surgery for the larger tumors, so the cosmetic benefits is usually excellent. But usually, if it's a small tumor, we can shrink it without even having surgery.
Okay. And then in regards to thermography versus like a mammogram, as a provider, I see this quite often where patients will come in and there's a lot of conflicting data out there.
Right.
Would you suggest both, or is there reasoning versus one or the other, or no mammograms?
Yes,
What would you say?
Low risk women, I don't think you need a mammogram. As long as you're checking your breast every month, a doctor's checking your breast once a year, and if you have lumpy breast, we can take care of that. So thermography, it's just a heat sensor. It's very accurate. It talks about the metabolism of the breast. So if you have abnormal metabolism, there's increased heat. Mm-hmm. You may not have cancer, but it can predict cancer 7 years before it occurs because you have abnormal metabolism. So we do our thing, and 4 months later they recheck it and it's back to normal. Yeah. But if you have a lump and it's suspicious, then absolutely that's the time you do mammography. Okay. Mammography. So mammography is fine for diagnostic reasons.
Okay. Tell us a little bit more about lifestyle when it comes to diet, environmental toxins. You love to run the environmental tox panel.
Right.
Vibrant. Shout out to Vibrant. So tell us a little bit more about lifestyle.
Well, okay. So the environmental tox panel, it will show you why you have to be organic in every way. Parabens, cosmetic, makeups, detergents. These toxins show up in this environmental tox panel. It's just a simple urine test. If those levels are high, they're carcinogenic. Yeah. Roundup, xylene, atrazine, even DDT. I've had huge levels of DDT a couple times. And in Indiana, farmers, there's a different name for it, but they're still using DDT in the state of India, which horrifies me. Yeah. So you have to be organic. Your makeup, the number 2 cause of toxins.
Endocrine disruptors,
I know your makeup, if it's not organic, it can have poison in it. The FDA is not regulated at all in America as of now.
Yeah.
So your makeup, your detergents, your dishwasher, plastics, plastic water bottles. When you travel, maybe, but the less you're exposed to plastics, the better.
Yeah, and it's a process too. I always tell patients it can be really overwhelming at first, to get rid of every little tiny thing. But it's a process. It's one makeup product and then detergent. It builds, so you can get rid of it little by little. Okay, let's go into treatment. So what would you say, or how do you address just overall treatment of breast cancer if a woman comes in? Obviously, it's varied per stage. Whoever you see at that time.
The smaller the lump, the better.
Yeah.
And usually we do an ultrasound, or if there's any concern, mammography, and usually they do ultrasound with mammography, which is extremely accurate. Mm-hmm. And if it is suspicious, then we do the OncoTrace. So if there's no circulating tumor cells and there's a lump, then it's probably an estrogen problem, and we can check estrogen, all the hormone levels, and literally just getting rid of the extra estrogen by natural aromatase inhibitors. There's prescription aromatase inhibitors. Cricin is the number one we use. We use DIM.
I use DIM a lot.
DIM is amazing. It just helps your liver metabolize estrogen. But stop putting phytoestrogens in your body. Pesticides are terrible. Sugar is terrible. So just getting on a fresh, clean, organic diet makes all the difference in the world. And when you have low insulin levels, you do not have chronic diseases, so getting off sugar is
metabolic
huge.
function is huge. It's the basis of how all of this starts. So
What are the metabolic disorders that people can have?
So typically when I say metabolic dysfunction, I probably use the word or the term way too often without actually explaining it. I'm essentially saying it's more of your overall A1C, which your A1C is the accumulation of basically your blood sugar. Fasting insulin is something else we look at. So again, how is your body utilizing your food sources? Is your sugar going way too high after you eat? Is your insulin basically resistant? Is it not working properly? So just, it all comes back to diet. Do you have a diet that is highly processed, foods that are highly, they cause a lot of inflammation, sugary foods? So really just prioritizing more of that protein, fat, and low processed or toxic food sources.
And back to prevention, probably, diet, exercise, but also stress.
Yeah,
as a
huge
functional
for
medicine
women.
doctor, there's always a trigger, and this trigger is usually stress.
Yeah.
And that we live in a stressful world, but how do you manage stress? So learn, mine is exercise. When I exercise every day, that's my release. Mother Nature is my release. Meditation, prayer. Do you have another way you
For stress, I would say, I love sauna therapy. So sauna therapy is not only amazing for just overall detox. You talk about sauna therapy all the time, but it's relaxing. It causes your body to relax, detox. I'd say that really helps with stress. Friendships, socialization is massive. So if you're a hermit, which a lot of us are in the winter because it's freezing outside, it's probably not great for overall stress. Getting out there, having that communication with others is really, really important. That's pretty much the main things that I like to address. And then also sleep. Sleep is massive. It's not always easy for some, but sleep is huge. You definitely have to get that sleep in order to have just emotional regulation and also just overall
and getting enough sleep.
Immune support, yeah. So in regards to treatment, let's talk about treatment real quick.
Yeah. So people are, everyone has a grandma or grandparent that they were diagnosed with cancer, and 1 month later they look like their death warmed over. And again, oncologist doesn't do it anymore. The target therapy, I do not fear the oncologist because oncology has changed so much in the last 20 years that the oncologists want what's best for you. We have, in the state of Indiana, we have amazing oncology centers, probably 5 of them. But if you are afraid to see oncologists, see us, and I can hold your hand if you have to do any targeted therapy. And I work with many oncologists are very open and kind with us, which wasn't that way 20 years ago when I started, but it is that way now because I send them 10 times more business than what I take away from them. Okay, so our treatments, SOT, messenger RNA has a bad rap because some people don't like the VAX, but we can't talk about that right now. But our SOT is messenger RNA targeted against your cancer. So we can literally, from your blood test, if you have breast cancer, the 97% chance there's circulating tumor cells in your blood. That's why we don't have to do a biopsy. And from that, our scientists will look into your blood, what protein is being excreted by the most active gene that's driving your cancer, and we can make messenger RNA, simple IV, that works for 6 months, infused in your body, just stopping the replication of your cancer for 6 months. There's no side effects to your body, cannot affect any other part of your body. And then cellular therapy, dendritic cell therapy. We can literally take your blood, have it go to a special lab that actually expands and grows out 15 million of your dendritic cells, the white blood cells that fight cancer. It's programmed to kill your cancer, 1 or 2 epitopes. It's a simple IV, 3 treatments in a row, 2 weeks apart, and this will start attacking your tumor. And lastly, the VaxoCure just came available 3 years ago. We can actually expand your entire immune system. It's amazing. Wow. I used to just do it for older people. If you're 30 years old and you have breast cancer, do you think you have a strong immune system? So literally the VaxoCure can expand, replace, and activate your T cells that attack cancer, the B cells that produce antibodies against your cancer, and dendritic cells. And with our clientele, I've never seen it not work. So there's no side effects of these. In fact, people say, really cool. So my husband needs drives. Like, no, when you do our treatments, when you feel better when the treatment's over, and yes, you can drive home because none of these treatments have adverse effect on the rest of your body.
Wow, yeah, that's really cool. All right, so anything else that you want to add?
Yeah, so in summary, most of the time, if you're diagnosed with cancer and you see a holistic doctor or integrative doctor, we will tell you, in 1 year from now, you're going to say that's the best thing that ever happened to me, because women worry about everyone else instead of themselves, and this is the one time you can use the C word and you can say no. So when everyone's trying to get you, say, okay, no, I am going to take care of myself. I'm going to eat right, sleep right, exercise, do my sauna, and I'm going to take care of myself. And so with our treatments, because we got rid of metals, the environmental toxins, all the proper nutrients and the vitamins that support your body, and 1 year from now you say, I feel the best I ever have. And I've heard 100 times, the cancer is the best thing ever happened to me because it made me take care of myself.
Yeah. Yeah, that's awesome. All right. Well, if any of these treatments or supplements interest you, you're welcome to check out our website. You can make an appointment with Dr. Fetters. Also myself, not necessarily for cancer, but just overall wellness, and we'll be happy to talk to you more.
Thank you for listening to the Optimal Wellness Podcast. Subscribe now to get monthly episodes to help you achieve your wellness goals. And if you'd like to learn how we can help, schedule an appointment at Health and Wellness of Carmel today. Just go to HWOFC.com or call 317-663-7123.